Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Vesicoureteric reflex. Vesicoureteric reflex is the most common heritable disease of the genitourinary tract. So the most common inherited disease of genitourinary tract is the vesicoureteric reflex. This vesicoureteric reflex, most commonly it is associated with autosomal dominant mode of transmission. The overall incidence is around, it is seen in more than 10% of children only, so it is very less. And in children, it is responsible for, it is seen in children with UTI of in around 30%. That means overall in children it is seen in 10%, but in children suffering with urinary tract infections, it is seen in 30%. Then almost 75% of the cases are asymptomatic, and the major cause of this vesicoureteric reflex is attenuation of trigone is the major cause of the vesicoureteric reflex. And its contiguous intravesical ureteric musculature. That means in the vesicoureteric reflex in the bladder, at the trigone, there occurs attenuation of the trigone. Here on either sides of the trigone, ureteric orifice will be there. Whenever there is attenuation of the trigone, this ureteric orifice becomes a little lesser. So as a result, there is actually it becomes a little wider, and as a result, there is backflow of urine occurs from the urinary bladder into the ureters. So this vesicoureteric reflex can be of two types. One, we have primary reflex. Second, we have secondary reflex. So primary vesicoureteric reflex and secondary vesicoureteric reflex. In primary vesicoureteric reflex, the submucosal ureter may be short, or there is deficiency of muscle, that to longitudinal muscle in the ureter. So here there is two things. One, the ureter may be short, or here the muscle is deficient. If muscle is deficient, it is not tightened enough to prevent the reflex. So if the muscle is deficient, then the muscle here, this orifice will be loose, or it is loose to cause reflex. It is not tight enough to cause um, it is not tight enough to prevent the reflex. So that is the responsible for vesicoureteric reflex. In secondary causes, whenever there is increased pressure in the ureter, whenever there is increased pressure in the urinary bladder, this increased pressure can compress the urinary bladder, causing vesicoureteric reflex also. So secondary vesicoureteric reflex is mainly caused by the elevated pressures of the urinary bladder. The most common anatomical cause of secondary ureteric reflex is posterior urethral valves. See, whenever there is posterior urethral valves, here there is a posterior urethral valve. So if this is the bladder, in the urethra, at the here in the opening, there is a posterior urethral valve. Because of this posterior urethral valve, the urethral orifice is very narrow. So as a result, the urine, in order for the urinary bladder has to push hard, or has to use more pressure in order to send this urine into this small orifice. So it takes lots of effort for the urinary bladder to push. So this is one of the cause for, so when it is when it is producing large amount of intravesical pressure, some of the urine will also extravasate back into the ureters, resulting in vesicoureteric reflex. The other causes of vesicoureteric reflex are neurogenic bladder or bladder dysfunction.
thank you and thank you for watching.